Seniors reach older ages, we are also witnessing increases in some level of dementia. In fact, according to a couple of studies that I've noted, seniors over 85, the majority have some level of dementia. And this has created a problem for many thousands of Twin Cities families. Well, locally, a number of firms have evolved to deal with this problem. We're pleased that one such company is with us today. The company is Cognitive Care Principles, and I'm pleased that two of the principals are with us. To my immediate left, Theresa Klein, President, and Jana Henderson, Director. Welcome.
Thank you.
This is a major, major issue indeed.
It is.
And so let me start out by asking this rather basic question. What does cognitive care mean?
Yes.
And what do you do?
Thank you. Well, as individuals, we are both physical beings and cognitive beings. And cognition basically means the process of thinking. So the ability to understand information. And there's a whole bunch of skills that help us in that thinking process. And we want to care for folks with dementia. As they develop dementia, they have difficulty with the cognitive part, not always the physical part. Mm-hmm. And dementia is not a normal part of aging. So as we work with individuals, we're not going to fix the dementia, but we can help them to live with the dementia and help their caregivers in that process.
Mm-hmm. So in other words, dementia, once the family hears that there's dementia, they don't have to wring their hands and say, oh, what's going to happen to us?
Correct. Exactly.
There are various levels, and a lot of people can live with that.
Yes.
Well, all right. Well, then, all right. So we know that cognitive care is not need not be horrible,
yes.
or the problem need not be horrible. What do you do exactly? What do you guys do? I know that you're occupational therapists. How do you get into the mix?
That's right. Yep. Well, oftentimes we're referred either by a physician or by perhaps a case manager or a family member, mm-hmm. and they are struggling. They maybe had that diagnosis, and now what? What do we do? So we're able to actually go in and work with the individual who has the dementia, mm-hmm. figure out what they're able to do, because mm-hmm. that's a key point. They're still able to do many things. It's not that with that diagnosis that suddenly they stop. Mm-hmm. And we determine what they're able to do and what they're not able to do. And then we find services to help them compensate for that.
Mm-hmm. Well then, but I know that you do something rather unique, so let me ask this question, and I'm quoting from your literature, and it begins, the literature begins with a question. What is unique about our approach, and why does it work? And then you say that Cognitive Care Coaches has reimagined dementia care. We have moved away from a model of care that promotes management and dependency to one that promotes living and partnership. What does that mean?
Absolutely.
Yeah. Well, we're really big on people, again, that people with dementia can live with dementia, and that we partner with the caregivers to take care of people, especially as they progress. It becomes, you need a team of people.
Mm-hmm.
Oftentimes when there's a diagnosis or when we see dementia or learn about it, it's focusing on the late stage mm-hmm. of the dementia. And oftentimes people stay within that early and middle stage for a very long time. Mm-hmm. And the idea that we can identify where their needs are and match resources to those needs so that it's not a guessing game.
So there are various levels of dementia.
Yes.
And so that many of the levels, the family member who has the problem can continue to live with the family.
Yes.
Yep.
Well, all right, let's talk about, I was reading some of your literature. Mm-hmm. Let's talk about you mentioned that you do evaluation, consultation, mm-hmm. coaching. Let's start with evaluation.
Yes.
And what does it mean you don't use a question and answer approach?
Yes, thank you. Thanks for asking. We have actually, a lot of the tests will ask what is the date, what is the year, and oftentimes for people with dementia, they actually can do quite well on that. Their mm-hmm. verbal skills oftentimes remain intact. Mm-hmm. When what our tests actually look at is we have people do things. We have them maybe make a piece of toast. Mm-hmm. We have them wash their hands. Mm-hmm. And we're really not looking to see whether or not they can do those things or not. We're looking to see how much help do they need in that process? What kind of directions do they need? Are they able to problem solve in that process? And because of that, people are often very receptive to our testing.
Ah, and then so therefore you do go into, from there you go into consultation, and what does that mean?
After we've done an evaluation, we then collaborate with the family mm-hmm. and kind of relay what the findings of the evaluation, then kind of help make a plan mm-hmm. with a particular family.
Mm-hmm. And then the next point we have here is coaching. Mm-hmm. What does that entail? I know that you gave me some notes which talked about the problem, for example, the mother doesn't want to put the clothes on.
Yes.
So the answer is what? Do you help the mother? You put out the clothing for the mother.
Yes.
So how does that work in terms of the coaching?
Well, in the consultation part, we offer ideas of how the caregiver can help them. So if the dressing is the issue, if we say to the caregiver, lay out the clothes or guide them step by step with how to get dressed. The difficulty is that sometimes it's hard for the family member then to take it that next step and actually put those into play. So in the coaching part, we work side by side with them. We help them practice those techniques on site.
Let's try something else here, because I think this is important. Okay. So the family decided, well, the grandparent can live at home, but we're all working, and we're going to have to leave the grandparent alone. Then you're not going to provide any sort of morning package or evening package where you hire people. How does that work? You say to the family, the grandparent should stay at home.
Yes.
But we recognize everybody leaves to work. How do you handle that?
Well, what we do is we actually connect them with resources in the community, like a home care agency or a home companion agency, and we can then educate the home care or the home companion agency on these techniques or these care strategies. So we guide them to the right resources. There are so many resources for seniors, and it's hard to know which ones, not all of them cater or service all the areas of dementia.
You could provide some of the information as to where they should go for assistance.
Exactly.
How about now? I wrote down here the note, how to avoid crisis. What does that mean, and what does it entail?
Yes, I think being informed, being educated, and part of that is from the very beginning having an assessment where you're able to understand what is it they're needing, and then trying to help them compensate for those needs. The other thing is talking, planning ahead, in terms of if a crisis does occur, what might we do in that situation? And the thing about dementia is that even though it is an individual disease process for folks, there is some common characteristics that can happen from stage to stage. So the idea would be aware and be prepared versus being surprised and knowing what's coming.
We're big advocates of having families go out, gather the resources, and making informed decisions rather than just choosing the first one they find. So
we appreciate very much this information because it is a major issue. Yes. We've been talking to folks from the Cognitive Care Coaches, and we want to thank them for their very helpful information.